Okay, yeah, great. Moving on to the next question. Okay, so what is GOI's, Government of India's role in national immunization? What is their role?
See, the Government of India is currently running a program Mission Indradhanush in
Mm-hmm.
collaboration with Indian Academy of Pediatrics.
Mm-hmm.
So, and there is some schedule, particular schedule, and it is also up to 16 years of age group. And these government vaccinations done at Anganwadi centers and then primary healthcare centers, district hospital, medical colleges. There is one thing which is missing that certain vaccines are missing in government vaccination program. And the issue is the great birth cohort of India. We have around 25 million births every single year. So if we have to give a vaccine in 4 doses, so government of India has to purchase 1 crore doses of single vaccine. So it is a huge sum.
Yeah.
Still, what I'm seeing is every year government of India is adding certain one or another vaccine in their vaccination program. Their vaccination schedule and vaccines are expanding. As if you talk about 4 or 5 years back, at present they are providing so many vaccines, and they are in process of increasing the number of vaccines in their schedule. So what I advise to everybody that if you cannot afford vaccination at private sector, obviously you have to pay there. Then go at government sectors and get your vaccination done, and you can talk there and ask them that which vaccines are missing. Like there is no hepatitis A vaccine in government sector, typhoid vaccine, chickenpox vaccine, meningococcal vaccine, swine flu vaccine. So these vaccines you can go and get from your private doctor. So this is like you have to see there is no such as लोग कहते हैं कि फीवर आ जाता है, ये होता है, पेन होता है, बच्चा रोता है. See, ये बच्चा वैसे भी करता है.
Huh.
So focus on the positive aspect.
Yeah.
If your baby cry for 2 days or 3 days or abdominal fever for 1 or 2 days, and your doctor will give medicine also for that. So
Yeah.
vaccination is important. Don't delay just for these things, the tribal things. Ki baby will cry, and we have heard that certain baby has this problem because of vaccine. No, go and take a vaccine. And at present, government of India has also started door-to-door vaccination. People are coming on your door, they are vaccinating your baby. I have seen people denying oral polio vaccine, saying हम अपने बच्चे को नहीं पिलाएंगे, हमारे बच्चे को नहीं
Oh,
होगा. This is wrong. This is so wrong. Because even if there is one baby infected with polio, you are a threat to the society as a whole.
true.
So
True.
don't say no to anyone coming to your room. You know, somebody is coming to your door, giving you free vaccine. What else you
Huh.
want? So
True.
don't no. At least to polio drop, never say no. This is the first immunization for polio, and every single child should get those दो बूंद जिंदगी की. Never say no.
Yeah. Yeah. Most definitely. Okay. The other question to you is, myths like baby can get fever, like you actually told these things, but paralysis and even mortality can happen after this immunization. So, like you said, that we should not think about it and we should get above it, and because back.
Few adverse effects are inevitable. Like if you get injection, any injection, you will have that pain thing there. There could be
Obviously,
some
that's the most
red
obvious thing. Yeah.
and local swelling also. And then there's certain adverse effect associated with every vaccine. So when you go for vaccination, your doctor will tell you every time that your baby may have fever, he may cry, he may develop swelling. So
Yeah.
he will tell you the possible adverse effect. No, they will not happen in every baby, but there are chances. And they will also tell you what you can do to minimize those adverse effects and to handle those adverse effects. So just talk to your doctor. When you have
Yeah.
your doctor around, just talk to them, and you can get every vaccine very comfortably. I have never seen that would never seen any major adverse effect because of any vaccine.
Vaccine. Okay.
Yeah.
I think I believe this here in India. People people have lots of money for buying properties, for buying jewelries, for they celebrate each and everything. In a big manner, in a big way. But the most ignorant in which they are is, I think, health, in the health department.
See
They
what I'm
never
telling you.
they
When a
never
baby is born,
considered. Yeah.
there is a big party at home. So many people
True.
are invited. Gifts are exchanged. I have met somebody. He was a nanaji of the baby. You know
Okay.
what he gifted his daughter's baby on birth. His grandson. He gave them. He spoke to the baby's pediatrician and
Yeah.
paid amount entire vaccination up to 2 years of age, and gave that
Oh,
vaccination card to that kid. And I was like overwhelmed. Like, what this that the person, how evolved he is. He
how
knew that
educated. I mean, yeah.
gift, gold coin and party and clothes. These are so these are important, but giving
Not important
vaccination
than health. Not important than health.
and giving vaccination up to 2 years of age. This was so innovative. I keep telling everyone that if you want to give something to your grandson or granddaughter, give them vaccination, give them good health,
Yeah.
because we have seen how Corona has done, what Corona has done to us. A virus, a invisible virus, has kept us inside.
Yeah. Yeah.
And also one thing more, that when we make our annual budget, we never put health in that budget. There will be
True.
things travel, for movies, for outings, for education, for everything, but there is no single
No,
thing
nothing for health.
health. Yeah.
Yeah.
There
So
is no concept of preventive medicine in India,
because
neither among yeah.
yeah, obviously because we have this thing, हमको तो नहीं होगा.
या हमको नहीं होगा, एंड ऑल्सो दे थिंक होगा तो हम एक दो मेडिसिन खा के ठीक हो जाएंगे.
Yeah, which is why whether it is a headache, stomach ache, backache, any ache, so we just go to the, we go to a medical store and we ask the person, chemist, to just give a medicine. We are
It
having
is
this headache, we are having a backache.
using seat belt or not using helmet. It is just like that.
Yeah, yeah, true.
They
I mean,
need police danda for the seat belt also. I don't understand that. It
yeah,
is for you.
true.
It is
It
for
is for
your health.
you.
Yeah.
Yeah, because
Yeah.
if they, I mean, if people won't wear helmets, so how will their hair and their how
Yeah.
are they going to flaunt it? I mean, yeah, which is
So,
why,
right.
yeah. So I think, okay, so which is why I think people not normally know that some people have typhoid, some people have, and normally in girls PCOD and these all things, and people don't know about it. I think this is which is which is happening because of this ignorant behavior.
And secondly, they don't want to visit doctor because they think that these expenses are useless.
Useless, yeah. Yeah.
They don't want to do expenses on health. Nobody wants. The majority don't want to do. This is the thing.
खामखा का खर्चा.
Yeah, and then I will tell you one thing, that there is something called TAP smear examination, and it is
Mm-hmm.
recommended every woman above 35 years of age should get their TAP smear examination done annually. So how it helps? It helps in detection of cervical cancer in very early stage, or
Okay.
cervical infection,
Mm-hmm.
and this and that infection, or if the cancer is there in its preliminary stages, it can be cured very easily.
Mm-hmm.
There's a very simple examination. You have to go to a pathologist. They will take your cervical smear. That examination will be done, and if it is okay, you should be very happy.